Welcome to INHE, Introduction to Massage Therapy, Test 1, Review and Explanations. As you prepare for your first exam in Introduction to Massage Therapy, it's important to understand that this material is not just about memorizing facts about learning how to think like a massage therapist. Everything you study, equipment, environment, sanitation, and professional behavior, connects directly to how you will work with clients in a real setting. Let's begin with massage tables and equipment. Massage tables are the foundation of your work. You should understand the different types of tables and why one might be used over another. For example, portable tables are commonly used because they're easy to transport, while wooden tables tend to provide more stability and a grounded feel. Aluminum tables, on the other hand, are lighter and allow for quicker adjustments. Understanding table width is also important. A wider table may provide more comfort for the client, but it can make it more difficult for the therapist to maintain proper body mechanics. This is where clinical thinking begins. You are constantly balancing client comfort with therapist efficiency. You should also be familiar with general table features, such as height, padding, and fabric. Each of these affects both the client's experience and your ability to perform techniques effectively. Now, let's move into sanitation and infection control. This is one of the most critical areas in massage therapy. You must clearly understand the difference between cleaning and disinfecting. Cleaning removes visible debris, while disinfecting eliminates harmful microorganisms. This distinction is essential, especially when dealing with body fluids. If a surface is exposed to body fluids, disinfecting is required, not optional. This is about protecting both the client and the therapist. Linen care is another key component. Linens must be changed between every client, regardless of how clean they appear. This is not just about appearance. It is about preventing cross-contamination and maintaining a professional standard. Now consider massage accessories. Accessories such as face rests and bolsters are not just add-ons. They're essential tools for proper positioning. A face rest allows the client to lie comfortably in a prone position without straining the neck. Bolsters support areas like the knees and ankles, reducing strain on the lower back and improving overall comfort. When used correctly, these tools enhance both safety and effectiveness. When used incorrectly, or not at all, they can lead to discomfort or even injury. Next, think about the massage environment. The environment you create directly affects the client's experience. A professional setting should be clean, quiet, and comfortable. Even small details, such as room temperature, play a significant role. If the room is too cold, the client may tense up. If it's too warm, they may become uncomfortable. This is where awareness becomes important. As a therapist, you are not just performing techniques. You are managing an entire experience. Now, let's discuss lubricants. Different types of lubricants are used in massage, and each has its purpose. Some provide more glide, while others offer more control. You should understand the general differences and when each might be appropriate. Safety is especially important here. Before using any scented product, you must obtain client consent. This is not just a preference. It is a professional responsibility. Some clients may have sensitivities or allergies, and failing to ask could create a negative or even harmful experience. You should also be aware that some ingredients are less desirable in professional practice. Understanding what you are applying to the client's skin is part of being a responsible therapist. Now let's connect this to your program expectations at INHE. You should be familiar with the structure of your program, including the total number of hours, how the program is divided, and what is expected of you each week. Attendance is not just a rule. It directly impacts your ability to learn and succeed. Clinical expectations are especially important. Arriving early for sessions ensures you are prepared, organized, and professional. This is a habit that will carry into your career. Dress code also plays a role in professionalism. Wearing proper attire, such as black scrubs, helps maintain a clean and consistent image, which builds trust with clients. Finally, step back and look at the bigger picture. Massage therapy is not just about technique. It is about professionalism, safety, and awareness. Hygiene protects health. Equipment supports your work. Environment shapes the client experience. Communication builds trust. As you study, don't just ask yourself, what is the answer? Instead, ask, why does this matter in practice? How does this affect the client? What I do in a real session? If you can think through those questions, you're not just preparing for a test. You are beginning to think like a therapist.